Hey there, I'm back with our Vital Signs video series, and where we're focusing on your understanding of vital signs. And in this part of the video, I'm going to be looking at respiratory rate or breathing rate. Now, the big question is, when you're feeling like somehow your breathing is not what it should be, or you're having what you believe is symptoms or signs of difficulty breathing, what does that mean? What can you gain from that, or what can you understand with that feeling when you go into it? So that's what I'm going to be talking about in this video. I'll be right back. Welcome back to my YouTube channel. My name is Dr. D. Terrence Foster. If this is the first time that you're joining us, let me just say to you, welcome. Wherever you are in the world, it's indeed a pleasure to have you here with us today. Now, on this channel, we focus on simplifying medical issues for everyone who may, for whatever reason, have felt left out. This is your channel. Consider subscribing. It is free, and we produce a new video every week. So let's talk about breathing. So what is respiratory rate? Respiratory rate is simply defined as the number of breaths you take per minute. It's that simple. How many breaths do you take each minute? Now, what do you need to breathe? And some of you are saying, well, I don't care, I just want to breathe. And that is fairly straightforward. But that's it. It's very simple. But you need your respiratory system to breathe. And what does that consist of? It consists of organs and structures. And those organs and structures are used for the exchanges of gas, which is primarily oxygen and carbon dioxide. Now, the organ system involves your nose or nasal passage. It involves your throat or pharynx, your voice box or larynx. It also involves a breathing tube or trachea, which connects to the larynx. And then those extend down and divide into two, which becomes bronchi, and those bronchi then extend into the lungs and become bronchioles, and at the end of those bronchioles are very small air sacs that are called alveoli, and that's where the exchange of gas occurs. Now, in addition to having all those lung structures, there's of course blood vessels which supplies the needs of the lungs, and there is the thoracic cavity which contain ribs and the muscles between the ribs, which helps to elevate and lower the ribs, increasing or decreasing the volume of the thoracic cavity and increase the volume of the lungs. Now, in addition to having that, there's also a diaphragm which separates the thoracic cavity from the abdominal cavity. And what that does, it is a dome-shaped muscle that either flattens out or it takes its normal position, which is a dome shape. And when it does that, when it flattens out, it increases the capacity of the lungs and the thoracic cavity. And when it takes its normal position, it then decreases the volume of the lungs and the volume of the thoracic cavity. Now, we also need our brain to control all of this system. And in the brain, there is a center that's called the respiratory center, or the medulla oblongata. And in this center, and it is this center that controls the whole breathing mechanism of our respiratory system. So that is also an important part of the organ and structures that we need in order for us to breathe. All right, now the process of breathing involves breathing in oxygen, and that is inhaling, and the process is called inspiration, and breathing out carbon dioxide, and that is exhaling, and the process of that is called expiration. The whole process of breathing in and out is one breath. So if you breathe in and then you breathe out, that is one breath. Now, you may have some difficulty breathing, or you may feel a sensation that, okay, I'm breathing, but this doesn't feel right. And that sensation of whatever it is, whether you're breathing too fast or too slow, that is called dyspnea. If you're breathing too fast, there's a term for that, it's called tachypnea. If you're breathing too slow or shallow, it's called hypopnea. If your breathing is deep and fast, it's called hyperpnea. And if you have no breath sounds, it's called apnea. If you experience any of these symptoms, or if you observe experiencing any of these symptoms, then the best option, of course, is to consult with your doctor to make sure, or your medical provider, make sure that the condition which you're having or you're experiencing is something that should be addressed and addressed according to the degree of severity that you're experiencing. Now, of course, if you're having any of these symptoms and you go to your doctor, they're going to examine you, they're going to do a chest x-ray, and they're going to see what is wrong, and based on what is wrong, then they would, of course, treat you accordingly. Now, here's a slide that I want you to take a look so you get an idea of what exactly inspiration and expiration. When you're breathing in, then what you have is elevation of your rib cage, the muscles elevated, and your diaphragm flattens out, and that allows more oxygen to come into your lungs and create a greater volume. When you're breathing out or expiration, then the diaphragm goes back up. It doesn't flattens out anymore. It goes back up, and the chest cavity comes in. So the air, in this case carbon dioxide, is pushed out. So that's basically inspiration and expiration. So it's important that you understand that simple concept. Now I want to show you, we'll take a look at this video of this lady, and she's breathing. And in this video, what we're looking at, you could watch the rise and fall of her chest. Is breathing in, breathing out, breathing in, breathing out. Now that is one breath, breathing in, breathing out per minute. So we observe the breathing. What we do, we time the number of breaths per minute, watching the rise and fall of the inspiration and expiration, inspiration and expiration. For a normal adult who no medical problem, normal breathing rate is about 12 to 20 breaths per minute. Now, if you're having any of those symptoms where you're breathing too fast or too slow, then your breath will be less than 12 or more than 20 to 25. Now, if you start getting over 25, your breathing is more than 25 breaths per minute, then usually there are any number of things could be happening. And we talk about the structures that are involved in breathing. One of the primary structure, of course, is the lungs. Any problem going on with the lungs, whether it be any sort of lung disease, emphysema, asthma, COPD, all of that, anything, whether you have cancer, have some infusion or fluid in the lungs, any of those will cause problem. Or if you have, say, congestive heart failure, or any, so that means stuff that affects the heart also affects the lungs in a lot of instances. So that could lead to a change in your respiratory rate. Now, in addition to the things that affects the lungs, which is pretty obvious that you'll have problem, but it also you'll have problem. Let's say you have a rib fracture. Then because of that fracture, it becomes painful. You're not able to elevate the ribs as you normally do. It becomes painful, and that will ultimately affect your ability to breathe and also your respiratory rate. So if it's a severe case where you have a fracture that punches your lungs, leading to what is called a pneumothorax, then that becomes more of an emergency where you may actually have one of your lungs totally collapsed, and we really got to put a tube in to expand your lungs or to re-expand your lungs and to allow you to breathe normally. Now, so that's important. Now, we talk about the brain being the primary respiratory center. Now, if the brain is affected, where the center is affected, it cannot have the control that it needs to have on the respiratory system, then of course it shuts down. This can occur, for example, in the case of use of narcotic, overuse, and sometimes not necessarily overuse, but just for that particular individual who has had too much narcotic, then that could literally shut down their respiratory center and their ability to control their ability to breathe. That will lead to respiratory failure, which is directly related to the inability of the brain to control the respiratory system. So that occurs. So all these things are important in terms of how they affect the brain. So be aware of those things: medication, narcotics, opioids affecting the brain, leading to literally shutting down the respiratory center, and therefore the rest of the respiratory structure will say, well, what do? We can't do anything because the brain is needed to tell us what to do. So literally you have your brain being shut down because there's not there's no control over the respiratory apparatus to make breathing and respiration be normal. So be aware of that. Now, of course, once you have some of these things, as I said, you got to see your doctor so that they could give you appropriate treatment, regardless of the cause of it. Some will give you nebulizer, they'll give you, put you in breathing treatment, all these different treatment to help ensure that your breathing is better, whether that be opening up your airway. Sometimes you get nebulizer treatment and you spray it in your nose or your mouth, and that will eventually lead to an opening or a dilation of your respirators, of your breathing tube and your airway, and that will allow you to breathe much better. So that's one of the reasons why you need to see your doctor or your medical provider so that they could provide the appropriate treatment. Therefore, this means that respiratory rate is a very important vital sign, and obviously it's closely related to oxygen saturation of the body. Now, although oxygen saturation is not one of the four major vital signs, it is still very critical and very important, and we'll discuss this in our next vital sign, which will be the last one in the series, and we'll also talk about pain level in that series. Now, we've previously discussed blood pressure, we've discussed pulse, we've discussed heart rate and temperature, and then of course in this one we're discussing respiratory rate. Be sure to check those out. I'll leave a link at the end of this video for you to check those out. I encourage you all to like, comment, and share these videos with your friends, family, and anyone. Please subscribe to this channel, and when you do so, don't forget to hit the notification bell, because that way you will be notified each time we release a new video. Finally, always remember, let us strive to keep a healthy mind and body. Thank you so much.